morning.
Good morning.
We're going to give Gina a couple minutes to set up in the other office, and then we'll get started. I hope everybody is nice and well this morning. It's a beautiful morning outside, nice and sunny with a nice little breeze. So it's a beautiful morning. Beautiful morning.
It is. It's an amazing, beautiful day.
It is. It is. Well, I'd like to welcome everyone to today's Café y Pan Dulce morning discussion on immunizations. So Café y Pan Dulce for the Hispanic culture is real traditional. We like to have some good sweet Mexican sweet bread and have our coffee, which is café. So we like to enjoy, especially on a nice breezy morning like this, some good coffee and traditional sweet bread and talk about just different topics. Traditionally at home, you would do this with loved ones, friends, community members, and just kind of get up to date what's going on in your community. So we're excited today to have our guest speaker, Dr. Poindexter. She is with the Chief Medical Officer of Community Health Network, and she's going to talk to us about immunizations. Dr. Poindexter, would you like to introduce yourself a little bit more?
Good morning, everyone. Again, thank you so much for the invitation to be here. I'm really excited about talking about this topic. You know, this seems to be my morning table topic. You know, when I do have that chance to relax on maybe a Sunday morning, to talk about the vaccine. So I think it's very, very important. I heard you mention immunization. I want us to think of it at this point as a vaccine because it is our choice to receive the vaccine. I am the Chief Medical Officer, as you mentioned, at Community Health Network. And as we all know, COVID-19 came upon us about a year ago. And Brazoria County, you know, we've all been affected by that, by COVID-19. If we have not had COVID-19, we know someone who's had it. And unfortunately, we've had loved ones lost as well. You know, who knew that they would have a vaccine available to potentially eradicate COVID-19? I just think that's the beauty of it, that's where we are. So as a community health center, we have worked from, you know, learning about COVID-19 to actually testing for COVID-19 to assisting our persons in the community, you know, to quarantine or isolate if they were exposed or had COVID-19. Now we're vaccinating those in the community for COVID-19. And, you know, hopefully soon we will also be using therapeutics to help treat COVID-19. We'll have that capability of monoclonal antibodies in the future soon. So, you know, even though it's been a very challenging time for everyone, especially in healthcare, it's been a challenging time for us, you know, family-wise, for the economy, for the loss of lives. It's just been 2021 was a different year, but 2020 was a different year. It was challenging, but 2021 is the year of hope.
Thank you for that. We all needed a little hope the start of this year. Like you said, with the pandemic and how many lives it has affected in 2020. So certainly appreciate those words. We have a few questions that we'd like to start off to ask. So I'm just going to jump right in.
Surely.
And I might get a little sidetracked because these were pre questions and there's some good ones and there's some that I might tangent off a little bit. I'll try to get back in. So there are rumors that people taking the Moderna vaccine will be required to take it for a third time. Do you know if this is true?
So as you ask questions, I love these questions. This is a good question. but I'm going to tend to also give us a little history right behind that. Moderna, right now there are two vaccines, Moderna and Pfizer. Pfizer came out first. Both are messenger RNA vaccines. Those vaccines work by spiking an immune response in our body. Yes, both are pretty much the same because they require 2 doses. The media, I don't know how much the media is our friend or not sometimes. I'm talking about social media, on television media, because there are a lot of things that they say. We hope that they would be facts, but also there might not be everything, given to you at that time. So for these vaccines, they're still being studied. And when I say that, we know they're safe and effective. And we know at this point we need 2 doses to make our immune response at 95%. However, will we have to have another one in the future? I've heard that on media. Maybe there's a third one, but at this point, there has not been any validation for that.
Okay. Thank you for that. So you brought up 2 interesting points there, and I kind of want to drift away from the question because we hear this a lot, and I've heard this a lot. The messenger RNA, how is that different from DNA? Because some people I've heard say, oh, it messes with your DNA because it says RNA. So I know that wasn't a prompt question, but that is something that I know I've heard people really concerned, and that's why they are hesitant to go get the vaccine, because they're afraid that this vaccine is going to somehow mess with their DNA.
So I'm glad you brought that up, because that is what creates a lot of the hesitancy, right, for receiving the vaccine. And we do know, it's important in our different cultures that, we dispel those discrepancies. So messenger RNA and DNA, or RNA and DNA, are different. The DNA, yes, persons are correct. That's about your genes, This does not affect your genes, your DNA. RNA, we can look at it more like a protein. It is, we have RNA in our system. However, we can look at the vaccine as a protein that's introduced into our system, and our immune system spikes a response against that protein. The RNA is not COVID. This is not the virus. That's another concern that people have. They think that the vaccine contains a live virus. There are some vaccines that do, but this is not. This is a protein, again, introduced, that's going to say, hey, it kind of looks like COVID-19. I need to fight against this. So that second dose, that's going to help us fight even more. I just got my second dose on Saturday, and my body did fight harder. So my first dose was great. And then on that second dose, my body said, that protein is not supposed to be here. Let's fight against that. And I could tell, so I did have some of the side effects that are common, that are already noted in your fact sheet. If you do receive any of these vaccines, they say you may have body aches, sometimes a little fever response or chill. But my body said, no, I don't like that. It passed within about 24 hours. And so I know my body's fighting against this protein that's introduced. So if COVID comes my way, 95% of the time, I should not get ill.
And I appreciate you saying that, because I think that's so important for people to hear that, they may take their first vaccine and get a little skeptical because they start feeling a little ill. So that's so important. And thank you for mentioning that. That's your natural body's reaction to fight off. I mean, our bodies do that. Anybody who's ever gotten a splinter knows that the body just naturally recognizes there's a foreign object and we need to fight against it.
Sure
So,
does.
so I'm so glad that you explained that and dispelled some of that uncertainty that's out there about the vaccine. Do you know when the elderly will be able to sign up to take this vaccine?
You know, the elderly should be signing up now. So when we're talking about, you know, we're talking about from our organization. I want to not talk about just CHN. I want to talk about what's going on out there. So the elderly should be able to sign up. And when I say elderly, let's say that we're talking about phases, and phase 1B, the healthcare workers were in 1A, but phase 1B includes 65 plus, when they started 75, 65 plus, then also certain chronic conditions or diseases that should be able to sign up. As we know, we all know this, that the allocation of vaccine comes according to what the state receives. So not, especially in the community, this is what we're fighting for, is to get more vaccine in the community. Most of the vaccine has been distributed in the larger sectors like hospitals and such. So we know that, say for instance, if someone may have been to one of the larger hospitals, UTMB, Methodist, some of those hospitals, they should be contacting people to get a vaccine, but that doesn't stop you from being proactive in calling and trying to register for the vaccine. There are some pharmacies as well that are receiving the vaccine. So I am encouraging everyone to get on any list you can, because again, the distribution of vaccine is limited at this time. We're hoping, you know, with the change of administration, that we will start receiving more vaccine. So I believe this week there was probably about 347,000 doses received in the state of Texas. You know, right now, Brazoria County, there weren't any ones listed on that. But they come, you know, like I said, CHN is receiving vaccine. We've had a chance to vaccinate, you know, persons. We will, you know, please watch our website at mychn.org, because, you know, as we receive more allocation, we'll be able to run more mass immunizations for the community. But if you can advocate for anything, advocate for your communities to get vaccine.
Thank you. And thank you for stressing the need to get this vaccine, and to sign up on any list, because, you know, the question may have been about elderly, but it's important to know, like you said, just to sign up, you know, get that, get on a waiting list. And you mentioned the different phases, and I've navigated through your website, and I see that you actually have the different phases throughout. I can't remember the last phase, but so you kind of put in your demographic information, and it tells you what phase that you're available to get the vaccine. So I thought that was great. It was really good information. Something that I read recently in the facts, specifically about Brazoria County, was they were concerned that they didn't have the percentage of amount of people to get that vaccine. I can't remember the data. I want to say it was like 67, 68% of Brazoria County community members are willing to take that vaccine. Can you tell us what that means for us as a whole? Because there's a lot of talk about, oh, we need to get 80% of our community vaccine for herd immunity. There's all this talk, all this, and you try to, you know, get to the facts, and you want to make sure you're providing evidence-based information to the community. Can you tell us exactly what that means?
Yes, I truly appreciate that question, because that goes back to the confidence in our vaccine, the hesitancy that people may have. And when it is your turn, please get the vaccine. If we do not get, you know, a certain percentage, and that's what we're talking about, in the 70s, 80%, of our community vaccinated, then we cannot develop that immunity to stop the spread of COVID-19. So that means if, I have the vaccine, you have the vaccine, and, maybe all of us around have the vaccine, then we shouldn't be able to pass COVID-19 to one another because we're protected. We have immunity. So that's the herd immunity that they're talking about. If we don't have those levels, then we're still going to have persons walking around that will continue to get ill, or, they may be spreading COVID-19 as an asymptomatic carrier. With the present vaccine, there, like I said, there are ongoing studies of how that vaccine will we know right now that we should not 95% of the time get severe illness or illness from COVID-19, but do we actually get it and carry it as an asymptomatic carrier? So if you have it, you have the vaccine and I have the vaccine, and we both are asymptomatic carriers, then we can't pass it to one another because we've had the vaccine. So, it's just kind of that simple if we get the community involved to have the vaccine. I'd like to ask a question. So what have you heard about some of the hesitancy about getting the vaccine? So maybe I could, we've heard a few questions, but maybe there's some more.
Certainly. I know one of the concerns that I've heard is, oh, they made this vaccine way too quick.
Mm-hmm.
I am not going to get vaccinated. There's no way. That's one of the biggest hesitancies that I've heard.
That's my favorite. I remember when I'm a big proponent and watcher of Dr. Fauci, infectious disease expert. I'm respectful of him, and he's just straightforward, and he puts out the facts. So I know we're going to get facts, and I remember when he said, it'll be about a year. Well, they knew a little bit more than what we did as a community, and some of those words didn't get out, I believe. That would have prepared us for this day. And one of those words are this has already been in the making. This vaccine technology has been in the making for like 14 to 17 years. And so it was up for Zika vaccines, Ebola vaccines. Remember those days? But it ended up being contained, so we didn't have to go through those vaccines here. So this technology was already around. So when they were able to apply this to another virus, they took the chance to do it, and they were able to do it, So at that point, when they created the technology, just taking a little piece of the RNA, the protein, to spike the immune process of COVID, not the virus, then they were able to create the vaccine. But what comes next? You need enough people to go through the clinical trials to make sure it's safe and effective. There are different phases of clinical trials that one may go through. There are 4 different phases. So one of the important ones is in that first phase where they determine safety. Is this safe on humans or not? So they surpassed that. They got to phase 3. That's phase 3 where they had been able to run these trials on I think maybe about Moderna may about 30,000 persons. They did have all populations represented except children. I know that's a question people have too, except children for the Moderna vaccine, and Pfizer also. So once we got to that point and we saw we could determine it was safe and effective. So that's why we got there so quickly in a year. Now, We don't know what's going to happen after that. Like, I don't know if this is going to be like the influenza vaccine where we'll get it again next year. That'll be coming. We're only about 7 months in to those other trials where they're finding out more information. And that's why I said I don't call it an immunization. I call it a vaccine because it's your choice to get the vaccine. It's not mandatory at this point. So we're just encouraging persons as your turn comes, but you got to be proactive, get out there on those lists. And when your turn comes, you can get vaccinated.
Thank you. That's very important. Just one other thing that from studies that we read, and the Hispanic Chamber was able to sit in with Dr. Fauci a few months ago. He provided us with a presentation, and it was, to me, very powerful to see the disproportionality of how Black and Brown people have been affected by this virus, right? Have been affected by COVID and alarmingly rates, right? So what can you do to assure those Black and Brown community members those are the ones that are hesitant, and rightfully so, I understand the fear, but what else can you do to assure our people that this is important, this is to fight against that virus that is targeting and infecting us the most?
I'm glad that's, you're asking that question. I'm stepping out there in both the communities, the Black and Brown communities, trying to dispel these untruths, but also I acknowledge the fear, that persons have. So my what I want to do is give the best information I can, the facts. And the facts are, I acknowledge what you feel. A lot of us feel that we have, and it's rightfully so, like you said, in healthcare, we haven't been taken care of the same. And then we can go as far back as some of the studies that were done at Tuskegee. Things happen there. But a lot of these things have been we've gone and we put controls in order so that it's not affecting it. It is controls that where we have to do certain things as far as ethics are concerned, that we are not despair, against different races or ethnicities. So those things have been put in order. It's hard. Some of the things that I hear, they still go back to some of those studies. These studies have been done on everyone, and this is the time that we are all getting vaccinated. This is just not, your one population here, one population there. We need everyone to get vaccinated. So I'm saying that it is safe and effective for everyone. At this time, I've also heard that persons want to do more research, and I'm just like, how much more research do you want to do on the research that has already been researched, right? So it's really hard. I totally understand, but when you're talking to persons, because as we are here, I think the first thing you want to do is ask what their fear is, and then you go from there and you start talking about the facts. The other important thing that I have been able to talk about in the African American community was that African American was head of this vaccination, Dr. Colbert, and so that has been relief. That is very, very important. But it goes back to we are dying disproportionately from COVID-19. You have a choice to get a vaccine that will protect you 95% of the time not to die, or get severe illness from COVID-19, and versus in Brazoria County, when we're looking at these from CHN, we're doing the testing here. I see it every day. There's disparities. We turn in this data every week. In the Hispanic community, we have 40% positivity rate. You know, we're seeing a difference. We have in the African American community 20% of a week. So, you know, that's just weekly now. So it changes, but it can be as not as 40, but as high as 30%. So those are higher than in the Anglo community. So it's very important, you know, if we have something out there that can protect us, that's safe and effective, that we go ahead and, you know, choose to do so.
Yes, thank you. I thank you for that. I thank you. Because that's really important for everybody to hear. And I appreciate the local level of advocacy that I have seen from our health department, trying to get people, because representation matters. So getting people of color to talk to the people of color in the community, to encourage them out there. So as a community member, I've been very appreciative of people like you, Dr. Poindexter, the federal level, you know, seeing, you know, our Vice President, you know, Kamala Harris out there, you know, and it's just in seeing that helps us, I think, and seeing that it's okay. And I'm sure people will wait to make sure that there's no major effect. They're watching everybody. So I think that's important, and I appreciate it from a community member. Your transparency and your honesty on that. Now, you had mentioned that children were not part of the trial. Do you know if and when that will take place?
Actually, Pfizer just enrolled, I believe, about 2,200 children from age 12 through 16 or 18. I don't remember off the top of my head. So they just completed their enrollment for the phase. And so we should be seeing something soon, some results from those soon. Now, Pfizer vaccine is as young as 16. And Moderna is at 18. So Pfizer did have some children enrolled in that original study, but now they're going as low as age 12.
Thank you for that.
So I'm excited, you know, to hear what that brings. So we should, I would say probably in the next 3 to 6 months, we'll start hearing more about children in that age range.
Okay. And I think that's really important to the community, you know, as we all want some normalcy back for our children. And we know that educators are on the list to get vaccine as well. Can you tell us what that process looks like for our educators?
As you know, that the vaccine has been limited availability. So educators are in that 1B phase. It is important for you to get on the list if you're an educator as well. If you're in the school system, I would, again, look at your pharmacies, look at if you've had any hospitalizations in the past or gone to the emergency room, you know, look to those hospitals to see if you can get on the registration list or at the pharmacies. We are, you know, at CHN, we have vaccinated some educators because they advised to go ahead and get people just vaccinate. You know, first we wanted the healthcare workers, but then we needed to just go ahead and vaccinate. We need to get shots in arms, as you hear them say. That's very important. And as early as possibly the summer, once we get that expanded vaccine inventory, we will probably be vaccinating even healthy people. So you know how fast these years are moving. So the summer, you know, July, June, that'll be here soon.
That's amazing. That's amazing. And we appreciate all the hard work that on the state level and the federal level on getting those immunizations. Mm-hmm. I know I read a report that they're going to try to fast track some more, 200 million more.
I think 200 million more, exactly. So if we see those come out, that's where hope it's coming.
Right.
Yes.
And that's how you started off our segment, that this is the year
Yes.
of hope. So that is exactly what we're hoping for. That pretty much sums up this questions that we have here. However, we do have a question in the chat box, if you don't mind.
No, go right ahead.
It says, I know y'all don't control how many vaccines are received, but why do you believe the state and federal officials are having issues getting vaccines out to the population more efficiently?
Look, I'm looking away because I'm like, is this a political question? Sometimes, so I can't answer that because I am not one of them. But what I will say is that, the transition in with the new administration, I believe there are going to be a lot of different things done, and a plan that will be in place, so that we can have this. I'll just tell you the structure right now so that you'll understand what the structure was, but it should be transitioning. The structure was, the federal government place or had the vaccines, for the companies, pharmaceutical companies that made them. Then when the vaccines were ready to be distributed under emergency use only, they're being distributed through a vendor, basically. So this vendor really, they're the ones that, determine, I guess, the allocation. So the states don't know how many vaccines they're going to get because they're coming from the vendor. So then when the state gets them, then they're going to allocate those to a mapping process originally that started off with where your healthcare workers. So of course, we saw Harris County get a considerable amount. And I'll say Harris County, but really they went into the hospital systems because, we have one of the largest medical centers in the world. And so that's where all your healthcare workers were. That's where all the allocation went in our area. We were fortunate that, we have a Community Health Network has eight sites that we enrolled in. And so we've had allocations for those sites, but they've trickled in. And the way the allocations are made, they're made at 100 at one time. So, it'll be multiples of 100 that you receive. And again, they use a mapping system to see who are located in the areas. And, one of the things we have to remember is that mapping for private or clinical is really based on the patients that are surrounding you, your patients that you have. So that's really how that occurs. Now, I don't think they took into account that, what about the persons, the educators, maybe the people that don't have doctors, or, there's just a lot of other factors that we have to think about. But I just believe that, there's going to be a change with the plan once these new vaccines come out, and they'll be allocated differently. They'll be allocated in the communities. I know at the state level, county level, people are fighting for that. And we know here at Community Health Network, we had an event last Saturday. It was our healthcare employees, but we vaccinated 147 at Alvin Community College through a drive-through event. So we're going to be doing some of our patients again this weekend, and we plan to do 400 that day, but that's all we have allocated. And we're getting second doses. Like I said, I received my second dose. We're getting second doses, so we have another allocation should be coming up this week for second doses, I would say, because that was the second allocation we received around the end of December. So they're coming, but they're just slowly coming.
I see. Thank you for that explanation, because I had wondered how that process was, and I had no idea about the mapping process. So thank you for that. We have another question, and it's a really good question because it's another rumor I have heard. I've heard rumors that this vaccine can cause infertility. Can you please address this rumor?
I've heard rumors too. I just to let you know, my specialty is OB-GYN. And so I have heard that, from patients. I actually have family members who are educators, and they were very concerned about taking the vaccine because they are going through infertility. And so I did a lot of research to make sure that that was not the case. Now, again, we have to disclaim and say a lot has to be researched in the future. But, just saying the type of technology that's used is a protein. It's not DNA. It's a protein that just makes an immune response. So immune response is not going to affect your fertility. The other is I've had concern with whether or not a pregnant woman should receive the vaccine as well. That is, a pregnant woman can receive the vaccine. Now, a lot of these things, make sure you discuss with your provider, your doctor first. But a woman who is pregnant, if she isn't exposed to high exposure, if she was a doctor, she's out on the front lines, she needs to be vaccinated. Possibly if there's someone that's pregnant and they're able to isolate themselves and don't need to be in around persons, then, don't vaccinate, wait until after pregnancy. Breastfeeding. Now, there's not a lot of data on that. So that's another discussion, to have with your provider. So yes, you're right. There are a lot of questions out there. There really are no contraindications or reasons not to receive the vaccine, unless you've had a severe reaction to the first.
Thank you for that. And very appropriate question for somebody who specializes in GYN. I don't know if there's any further questions. I will give everyone a few minutes if they want to put their questions in either the Q&A or the chat box. But in the meantime, I do want to thank you, Dr. Poindexter, for taking the time out of your busy morning, to come and speak to us today about the vaccinations, and how important it is for each one of us to do our part to help our fellow Americans. So I appreciate that. And thank you to Community Health Network on behalf of the board of directors. This discussion has been very interesting, very intriguing. So I've enjoyed being part of it. And if anyone listening is interested in holding a Pan Dulce discussion, we would love to get in contact with you or be in contact with you. Feel free to contact the chamber, 979-233-2223, or you can email at event@bchispanicchamber.com. I don't see any further questions. Dr. Poindexter, is there anything that you'd like to finish us off with?
Yes. Again, thank you for letting me have this conversation this morning. It does not. I think it's more value for me to take out of my time seeing patients this morning, versus talking to you all. Because talking to you, like I said, then you can go out and do the work too and talk to others. It's very important for us all to understand the facts, and that, this vaccine is safe and effective, and it will prevent, severe illness 95% of the time. I think some good points, again, to be proactive in getting registered to take this vaccine. You might not get a call from anybody, so you might not know when it's your turn. It's really important to do that. If you have questions or you still have fears, there are a lot of persons out there, including myself. I'm here at Community Health Network. I will talk to you again, because I believe it's important. Remember that magic number here in our community. We probably, like you said, are down at 60%. The Black and Brown communities are down around 57%. we have to raise the bar. We have to get up there so we can stop this pandemic. And the last thing is I want to make sure of is that we all understand, regardless if we take the vaccine, we still have to wear a mask. We still must social distance, and we still need to use hand hygiene until we reach that high bar to end that pandemic. So thank you again for having me this morning on behalf of Community Health Network.
Yes, thank you. And thank you for that last tidbit, because that was a question that popped up. If they've received their 2 rounds of vaccinations, does that mean it's still necessary to social distance and wear a mask? So I appreciate that so much for your honesty, and again, your candid ability just to influence us and to get us out there and debunk some of the rumors out there, which I'm sure there's plenty more that we weren't able to cover today. But thank you for your time. Again, thank you everyone for joining us today on behalf of the Hispanic Chamber. We have enjoyed this conversation and look forward to having more. Thank you, everyone.
Thank you.